Good evening. You are joining me at Spotlight tonight. And tonight on Spotlight, just like on every single week, we are going to speak about a topic that is in hand, a problem that needs to be addressed. These are sometimes problems that arise in our head when it comes to certain decisions being taken in the country, such as the resumption of schools and also the relaxation of travel restrictions in the country. Because as a student and also as a parent and also as a fair citizen, you come up with questions whether it is time to do it, because we have learned our lessons in the previous times as well, in terms of seeing the numbers rising every time there has been a travel restriction release. And today also to speak about these matters, to iron out all your concerns, we have brought down a doctor here today, and this is none other than Dr. Manalika Sumanatillaka, consultant endocrinologist attached to the National Hospital of Sri Lanka, and the Vice President of Sri Lanka Medical Association and the President of the Sri Lanka Diabetes Federation. The reason why we invited a doctor, a professional, a medical professional like this to the studio today is because we want to address this matter in different aspects in terms of the health of yourself and also the health of your child who will be going to school in a very short time in the coming weeks, and also about yourself and your neighbors and your family who will be in the society in the next coming weeks, as well as decisions are being taken. So doctor, good evening to you. Great to have you in the studio. Let's speak out about the SLMA, Sri Lanka Medical Association. Now, this is a term we keep on hearing on TV a lot, and we know that there's so much of work being done in terms of trying to curb the virus and the spread of the virus. As the Vice President and as the SLMA, what is your role, and also what is the association's role in terms of this?
Yes, the Sri Lanka Medical Association, which was started in 1887, and it's almost so many years, one of the oldest medical associations in this part of the world, Australasia region, and it's the premier medical organization which has a membership of thousands of doctors in all specialties. So it's the as a national organization and of doctors, professionals, it's our duty to guide the health authorities and the government at a time like this. So the advocacy played by SLMA was that. So we were just rising for the occasion.
Right. So that raises another question now when it comes to the regulations and the rules that you have to follow of the government. Sometimes, as the association, sometimes you might be feeling certain difficulties. You might be facing as a person, as a profession, and also as an association as well. What's your input about that?
So the past 1.5 years have been a very difficult time for everybody. So people were having different ideas on how to tackle the problem at hand. So as an organization, what we did was we got the experts in the field, relevant fields. Experts, they were world experts sometimes, Sri Lankans living abroad. And then we have formed committees to advise the association on COVID matters, on vaccine matters. So that relevant area, we had a lot of experts giving their expertise, from immunologists to epidemiologists, then physicians, and other doctors who are treating the patients and who are in the labs, the doctors handling the laboratory. So we had expertise of all these doctors, and then we used to come to our conclusions to help our health ministry and of course to guide the government to take correct decisions as far as possible when tackling with this, what you call as the unseen enemy. So we are battling a unseen enemy, and then the battle that we had to face, and we still, I don't think it's over. We need to carry on for we can't predict, but at least a few more months.
Few more months,
or maybe even a year. We can't predict, but that's what we have been doing.
Right. So if you go back to the previous times, every time the country was the restrictions was released or relaxed, we could see every time it happened, the numbers went up. I mean, it was chaotic basically, and we had to start from scratch. Will it happen again this time as well?
Yes, that we have to learn from our mistakes before. And especially the Sri Lanka Medical Association looked at that well in hand with the with the help of the College of Community Physicians, we prepared a very elaborate document on how to open up the country in a phased out manner, and how the different sectors can be opened up, and how the schools can be opened up without causing a much of a problem. This has been handed over to the Ministry of Health, and the relevant experts, I'm sure, would have studied that. And if you stick to the rules, if everybody sticks to the rules, especially when you are opening up the more, I would say, super spreader sectors now. So what's happening now at the moment, it's partially open. As you can see, people are going about. There are so many businesses and industries are open, but still we are at a reasonable level. But the super spreader sort of sectors would be the public transport and allowing get-togethers, weddings and other get-togethers where large numbers in close proximity, in close spaces gather. Those are the problems that we will face. But we have specific guidelines on how to have those occasions as well. But if people stick to the rules and the authorities make sure that that is done, then we shouldn't have a problem. Otherwise, again, we'll be back to square one.
Back to square one. I think so. The people have I think every individual has their own responsibility to stick to these rules and regulations.
I think so. In a situation like this, I think we should not point fingers at the authorities or this. They just can't handle a thing of this scale. Each individual, we must take our health to your own hands and protect yourself. Stick to the rules. Whenever you are going out of the house, think whether it's really necessary, my trip outside the house. And then wherever you go, try to stick to the rules. If the place is crowded, please don't go in.
Exactly.
I mean, there may be situations that you have to do it, you have no alternative, but make sure that you follow the simple measures like wearing the mask properly, washing your hands and maintaining the social distancing. So if everybody does that, we won't have a big problem.
Exactly. So because some actually think that once you get the vaccine, you're not avoiding it completely. You can get it contracted at the end, but then again you can also bring it home.
Yes.
So
that's the point that lot of young people and those who are going out might have got it wrong. They say we have got the vaccines, 2 vaccines done. They think that's it.
That's it. Yeah.
It's good. That will prevent you from dying from the illness and greatly reduce the risk, but not 100%. 100%. That too. But you will be transmitting it to others, especially the elders at your home. Even if they are vaccinated, still they can get it, and a small percentage of them can get into trouble even with the vaccination.
Right. So if we take a look at the pathway that you have designed, the strategy that you have designed, you and the Minister of Health, all these parties all together, in terms of opening up the country once again, who will be given the priority when it comes to, will it be the transportation industry, or will it be other industries?
No. Now already under the current travel restrictions, you could see that individuals are going in their own vehicles in large numbers. We could see even traffic jams on the road like before, but they are going in individual vehicles, so the spread is less. So what I meant by super spreader means that one infected person, let's say that a person who is infected or is having the disease is going in his own car. He goes to an office and works in his own office, and minimal contact, he sticks to the rule. He may not spread the disease, and maybe to 1 or 2 people. But if there are 1 or 2 infected people in a packed train or a bus, and in that bus people are from different villages and different parts of the country, and that could be a super spreader event where one person might spread to hundreds. So that's what I'm talking about. So we have to be very careful about those things.
There's also a concern among the public. Now, see, the easy answer is always close the country. I mean, close the country. Whenever you face something, just close the country. That has been something like a mantra that we've been hearing. But one might think that this is because the doctors are giving the easy way out, only because the system, the medical system, and also the professionals are not skillful enough. Is that right?
Okay. So, I mean, we have to admit, we are learning on the job.
Yeah.
All the doctors have to go to back to medical school.
That's
because
right.
this is a brand new virus. Brand new disease. The whole world is learning about this thing. And unfortunately, we don't have a specific drug that will work for the virus. So, the social distancing and these other measures are, the travel restrictions are the best answer at the moment, other than the vaccination. So what we are just buying time by doing that. So as you said, yes, doctors and the health staff have been working tremendously over the past 1.5 years. It's just that it's when our capacity is saturated, or it goes beyond our capacity. Our greatest fear was that the death rate used to be about 1.5. Then it shot up to about 2.5. Yeah. On the verge of the system getting saturated or overwhelmed, we knew that if it had gone beyond, we are willing to work, but where is the oxygen? Where are the beds to put the patients? And when you want to give oxygen to a patient, you need lots of other equipment, even if the oxygen is supplied, right? So if we get overwhelmed, the people that can be saved also would have died. Yeah. Then we have seen by experience in other countries, when that happens, the death rate jumps to like 5 to 10%, and thousands of people would have died. And I'm very thankful that that did not happen. On 20th of August, it was predicted that if it has gone the way it was, by 2nd of October, 20,000 people would have perished. Yes. And by 21st or 22nd, by this time of the thing, 10,000 people more would have perished. So I know it, unfortunately several thousands have perished, but the number didn't reach that amount. So we were managed to save thousands of people by effecting this, at least the limited travel restrictions.
Right. So then, okay, also like when you speak about this opening up of the country, now based on your experience, I mean, we have all experienced this, but then as a medical professional, you have been able to see it in a different perspective. Now, are you certain that if you follow this pathway, there wouldn't be another way?
No, you cannot be certain, but compared to the other instances where we have gone into lockdowns, open up, then again the wave comes, again we went to lockdown. Here, what is the difference? We are on a better wicket now at the moment. Nearly 55% of the country has been fully vaccinated. Yeah. And then hopefully by the next few weeks we can increase that percentage. And basically we have covered most of the people with the high risk group, above 60, with diabetes, heart disease, and other hypertension and other diseases have been covered, almost I think 99% of them. So we are on a better wicket to face the virus. So I've been telling this, that it's always a competition between the virus and us, the humans, and we were losing the battle earlier. So the only guard that we have at the moment, or the best guard or the protection that we have from the virus, is the vaccine, which we have been successful in getting into a larger percentage of the population. So when you reach about 80%, that would be the best scenario. Right. So even at 50, 60, we need to follow these rules for some more time, at least few months, maybe till end of the year, if you want to avoid another calamity, maybe a smaller scale.
Right. It was also like concerning recently that to see another variant of the virus also rising in I think South America and also African region. I mean, if this gets out to the entire world, there will be a fourth wave. And if that
whatever
happens,
it will go on. Yeah. So that's why we are saying, that's another point that I must tell you, that how does this variance come or happen? Right. It's the number of infections that's happening between humans. Right. This is a virus, right? mRNA virus, which cannot grow on the outside, unlike other germs, right? Right. So it has to enter a human body, enter our cells, and then only that can replicate.
Okay.
So if there are more and more people infected, then more and more cells, viruses are multiplying in their bodies,
Right.
then there is a higher chance of these variants emerging. So if you bring down the infection rate,
Right.
the emergence of variants also will go down.
Right.
So that's the whole thing about this social distancing and lockdowns.
Right. So if case, the worst case scenario, if we end up having another wave, does Sri Lanka have a strategy to tackle it?
Yes, of course, we have been aggressively managing it, and I think quite well. Although we lost so many people, we are so sad about that.
Yes.
But I think we can face it, provided that everybody helps us. As and when required, the medical professionals will tell you what to do. If we really need a lockdown, then we have to go for it. But otherwise, if you stick to the rules, and then because the disease sometimes, if it takes time, and if you give plenty of oxygen and give them the proper supportive treatment, the majority comes out of it. You know, the death rate has been about 2.5%. So if you can give that, but if the system gets overwhelmed, you can't give that attention to each patient. That's
right.
when the death rate goes up.
Goes up.
So hopefully, our hope is by say middle of next year, or when we get everybody vaccinated, we can tame this virus and get it down to a level of a common cold, because it's just a virus. Because it was brand new and a new variant and nobody was exposed to it, that's why it's spreading like wildfire.
Right. So do you think we will be seeing any herd immunity anytime soon?
Certainly. Now people, hundreds of thousands would have got the infection, and then we are hundreds of thousands getting the vaccines. Even the children will be vaccinated, and hopefully all of us should be ready to face the virus when that happens. About 80% of the population has some sort of immunity against the virus. That is called the herd immunity.
Herd immunity, okay. Right, there was some news, I think, in the US or somewhere they found someone with super immunity. I think if that can be replicated or something, that'll be a very good case. And so we've been speaking about this reopening of the country. What about the resumption of schools? What do you think about that? I mean, children. You can't tame them. Obviously, it's not that easy of a task. How do you think this is going to affect them and the education?
As you can see from the other countries as well, children themselves won't be at very high risk. Of course, there are problems. There's inflammatory syndrome happening, and for some children have perished as well. But the complication rates are very minimal among the children. So our strategy has been to, of course, we are going to start vaccinating the children as well. So they should be able, there shouldn't be a problem for them as well. But the vaccination is not 100% essential for them to get back to school. That we must say.
Why is that? Is that a biological
because but they can face the virus better. The concern was that the children taking the virus home, and then your elders, your mother, father, grandmother, grandfather. So when they are all vaccinated, opening the schools won't cause a catastrophic problem of spreading the virus. Of course, the child can be affected. So as much as possible, we should stick to the rules. I am sure our children can be taught and disciplined, and somehow get them to stick to the rules to minimize the infection rates in the schools, and then quickly get them vaccinated as well. As soon as possible. So we are targeting initially the susceptible children, the children with diabetes and other inborn medical conditions, and those who are sick children, they are being targeted and vaccinated before they are sent to school.
Right. So about the vaccination of the students now, especially about those who are having underlying medical conditions and those who are not also. Now their parents are actually sort of reluctant because of the myth that's going on, even among the younger crowd as well, that if you take the vaccine, something might happen in the future for their any system in the body. What's your input on that?
Okay, we are facing a very difficult time. and we have fast-tracked all the vaccines, it's true. Right? Any other period in history, if not for this pandemic, we would have taken years to develop these vaccines. We have fast-tracked everything, but the minimal general precautions have been done, and it has gone through all the testing, and the World Health Organization has approved all these vaccines. So yes, one in 1,000 or one in few thousands can get a reaction, allergic reaction, some side effect, minimal side effects can be there. But with any of these vaccines, we have the experience. The other countries have been far ahead of us.
Yes.
So we have the experience. We are following those studies and making the recommendations here. So our children are not the guinea pigs, the other countries have given, and they haven't seen much of a problem affecting any system due to any of these vaccines. Of course, one-off reactions, allergic reactions, things like that can happen.
Right. So when it comes to the selection of the vaccine, do parents have the authority to select which vaccine they want to give to their children?
Unfortunately, we can't have that luxury. And of course, the professional organizations have recommended the Pfizer vaccine for the children because that has the best evidence. The studies have been done and it has been given in other countries. So the SLMA has recommended that, and the College of Pediatricians I saw has recommended that. I'm sure the government will follow that and get so it's one of the best vaccines available for this thing. So, I mean, you have to, choosing something has to be done on medical grounds. The parents might find it difficult to choose what's right. So you have to ask your doctor if the child has any specific illness which might need another vaccine, that it's under a doctor's prescription that they will give the vaccine, unlike for the elders. So you have to discuss with the child's doctor if he's having a specific illness, and they can decide on the type of vaccine, but I would say that it's fair to ask the parents to decide on the vaccine.
Okay. So this is a decision that to be taken in the
by
future.
the medical, the doctors managing the children.
Okay. And now I'm understanding. Now these studies could be the reason why certain countries have not recognized certain vaccines. The number of studies done on certain vaccines. Is that correct?
No. Okay. So they go by the level of data available. The certain vaccines, they don't bother publishing in certain language, English language journals and things like that. Maybe there are a little bit of vaccine politics as well as everything else happens in the world. I think that is more of a reason than any of the vaccines being inferior. The ones that have been approved by the WHO. They look at it technically and give the approval. So I don't think that is a big issue.
All right. So Doctor, now as the final question, as an advice to the public out there and to the children, because now as we raised, there are parents who are sort of scared to send their children to their schools, and there are also parents scared of getting the country open at the end, because even though how much you want the country open, when they announce the country is going to be open, you all panic, right? What kind of advice do you have to give to the society about how to behave after the pandemic?
So now, if you see, from 20th of August, we have achieved a reasonable level of control, but don't be happy with it. We are still 50 to 60 to 70 people are dying a day on a single day, and about 1,000 odd people are getting infected. That's who are recovered. I mean, which we detect. So undetected infections may be much more, right? So, but we can't go on like this forever. So we have to come out of it, and the vaccination is also, on the other hand, going very successfully. 200,000 to 300,000 a day being vaccinated. So we are winning the battle against the virus slowly, but we are not yet there 100%. So be cautious. It's okay as and when the government says the sectors will be open under the health guidance. Please, go ahead and come out and stick to the health rules that we have been telling over and over again.
Right. Okay. So which means as long as you adhere to the health guidelines given, you can definitely tackle the virus, at least by contributing it to in certain extent.
Certainly.
Right. Okay, right. So with that note, we have come to the end of today's discussion. Thank you, Dr. Manadika Somatilaka, for coming in on board with us and for sharing your insightful knowledge with the public. We will be coming again next week as well with another insightful discussion on Spotlight. Have a good night.